I'm Dr. Jeremy Parcells. I'm one of the partners here at Surgical Associates of Mansfield. We have a presence in both Mansfield and Arlington, Texas. Did my medical school training at Baylor College of Medicine, located in Houston, Texas. Went on to start residency in Galveston, but due to Hurricane Ike, ended up relocating and graduating from the University of Kentucky. I did my fellowship at the University of Nebraska starting in 2012 and graduated in 2013, specializing in a wide range of minimally invasive and laparoscopic procedures, including bariatric surgery. When I graduated from fellowship, I felt pretty well trained in laparoscopic surgery. My initial interest in medicine happened around the time I was 12 years old, after I suffered a pretty severe broken leg playing tackle football with some friends. A few weeks after the episode, I was on my way to recovery. I had a chance to look back and just see the impact that the orthopedic surgeon had on my life. When I was 16 years old, I had a chance to go spend a few weeks with a group of orthopedic surgeons. And initially I was just with them in the office, seeing patients and getting to experience some of the more routine things. But after a little bit of time, they brought me into the operating room. And I remember that first case was a big spine surgery, and I was quite nervous that I wasn't going to be able to handle it. And I remember going in there having hardly eaten all day long. By the end of the case, I left practically wanting to do cartwheels out of the operating room. I was just so excited. It was one of the most amazing things I'd ever seen. Next day I got to watch a second operation, and as I was leaving the hospital after that second operation, I started to reflect on it and think, this isn't something I want to do, this is something I have to do. And it really took off from there, and there was never any doubt that I felt called to become not just a doctor, but become a surgeon. As a general surgeon, the main focus of our practice is abdominal surgery. For a long time, abdominal surgery was primarily done through big open incisions. Then about a quarter century ago, they first started doing gallbladders laparoscopically. And after they saw the dramatic benefit to patients, they started doing bigger and bigger operations laparoscopically. We tend to specialize in fixing hiatal hernias and offering other operations for patients suffering from gastroesophageal reflux disease. The most common operation we do is removal of gallbladders or cholecystectomy. We also operate on colorectal disease, and I perform bariatric surgery to help with weight loss. A conventional laparoscopic cholecystectomy is done through 4 small incisions, but using the robot, people are able to take it out through 1 small incision at the belly button. I was set up to do a combination case where a GYN was going to be performing a hysterectomy or taking out her uterus, and I was going to need to do a colon resection. This particular GYN was big into robotic surgery, and he was already going to be using the robot, and so I said, you know what, why don't I give it a try? Patient did remarkably well after surgery, got out of the hospital quicker, and I was almost an immediate convert, to the point of within a month or 2 making the decision that I'm doing all of my colon resections robotically. So now I'm doing gallbladders and colon surgery robotically. The next area that I finally decided to give a try on was fixing groin hernias. Wasn't going to do umbilical hernias or incisional hernias, but would just give it a try with umbilical hernias. Now I was already fixing my inguinal hernias laparoscopically, but I decided to give it a try with the robot. I remember that first case. It took a ridiculously long time to finish the case. I was so frustrated during the case, and I swore after this one and the next one I booked with the robot, I'm going back to doing these things just laparoscopically and not messing around with the robot to do these groin hernias. Was just so worn out during the case. At the end of the case, we decided to keep the patient overnight, which isn't the norm, but for this gentleman, he was a little bit older, and we said, you know what, we'll keep him overnight and we'll send him home in the morning. I remember going to see him the next morning, thinking, man, that was a painful case last night. Went in and I said, how you doing? How's your pain? And I'll never forget his response, because it's when I decided I was going to have to start doing a bunch of robotic inguinal hernias. He looked at his belly and said, I wouldn't call it pain. He points at the 3 small incisions and says, I'm a little bit sore, but that's about it. At that point in time, I came to the realization I'm going to be doing a lot of robotic inguinal hernias repairs. Now I'm to the point where I can do a robotic inguinal hernia repair that I can even do it faster than a laparoscopic inguinal hernia repair. And so on and so forth. I began doing more and more and more robotic surgery until I became the busiest robotic surgeon in Tarrant County. So I started in fellowship at the University of Nebraska And the way the fellowship was broken up is there was 2 fellows and we would do 3-month rotations. So my first 3 months I was doing advanced laparoscopic non-bariatric surgery, while the other fellow was doing bariatric surgery. And we would flip back again and flip back one more time. So come October 1, I switched on to the bariatric service and we started seeing the pre-ops and post-ops of people who'd come before. And we operated on people who'd already gone through the whole pre-operative process. And I started seeing these patients after surgery, patients 2 weeks after surgery and 6 weeks after surgery. And the way the weight came off, and patients who were already 6 months out from surgery coming in and showing me photos of how they looked before. I've found that when it comes to bariatric surgery, it's as rewarding as any other part of my practice. My wife's also a physician. She's a pediatrician who specializes in adolescent medicine or teenagers. My sons are 7 and 3 years old. The 7-year-old's getting more and more into baseball, so he's in the middle of his baseball season now. And he also gets a big thrill out of going to see the Rangers games, so we try to get out there as much as we can during the season. 3-year-old really just wants to do whatever his big brother's doing, so his big brother plays baseball, and of course he wants to play baseball too. Every day we get up and go to work and are there in the service of our patients and our community. Furthermore, we're going to conferences, reading, pushing to try to grow and expand our practices, to try to make ourselves better at what we do. We find in many ways that we're constantly updating and modifying and trying to do our operations better, safer, more efficient, less invasive. One of the things that we have to keep in mind as surgeons is that while surgery becomes fairly routine to us, for our patients and their families, it's oftentimes a pretty scary event and frankly ends up being one of the bigger events in their life. To that end, we take it very seriously, and every single time we do an operation, whether it's a unique operation that we've only done a few times or it's a common operation like fixing a hernia or taking out a gallbladder that we've done 1,000 times, we're very deliberate about what is the right thing for this patient. So when that continuous push leads to certain wars like Top10MD, while it's not what you initially set out for, it feels pretty good.